of the agencies represented now. Good morning and welcome to our press briefing for this week. We do have a lot of great information to cover, so we'll go ahead and get started. I'm Christy Campbell from the Cole County Health Department. I do want to let everybody know that we've really seen a decrease in positive cases and hospitalizations over the last few months and in the last few weeks, and we're very optimistic about what that means for our community. And we're very thankful for all the preventative measures that our residents have been taking. And we're very, like I said, optimistic, especially with the vaccine rollout. All of the organizations have been, having ongoing vaccination efforts at their clinics. We're going to give everybody a chance to highlight those efforts today. And we're going to talk about some exciting events that we also have coming up in the capital city. The first thing I wanted to talk about was the regional implementation team. The Cole County Commission did sign a contract for the Cole County Health Department to be the lead for a regional implementation team that will work with the state on coordinating vaccine efforts for Region F. The Health Department will be the lead agency in this team. We will not be the only agency. Thank goodness we are blessed with great community partners, and we are working on adding members to that team, but we know that people from Cap Region Medical Center, SSM St. Mary's, JCMG, the Community Health Center have already volunteered to step up and be part of this regional implementation team. And we are very thankful for that. I know that other agencies will be joining us. We will be having a liaison with our Region F administrators in all of Region F. Our Emergency Management Director, Sierra Thomas, is going to be on the team and help lead us, and along with our emergency planner, Chris White. So we are assembling a great team that will work together for this entire Region F to help coordinate these vaccine efforts. The first thing that this team has been tasked with is working with the Missouri National Guard on a testing event. The testing event for our community will be next Friday, February 5th, and then the second dose for those residents will be February 26th. So several organizations are partnering with the National Guard to provide this. So the local organizations involved are Capital Region Medical Center, SSM St. Mary's, Jefferson City Medical Group, the Community Health Center of Central Missouri, the Cole County Health Department, the Cole County Emergency Management Office, Cole County EMS, Jefferson City Parks and Rec with the link, Jefferson City Fire Department, Jefferson City Police Department, Lincoln University, and central bank companies. Each local organization is taking a role in either organizing the event, registering participants, or being vaccinators or assisting with the event. Staff from central bank companies will be calling residents who are 65 and older that have previously registered on the Cole County Health Department survey to schedule an appointment for next Friday's event. It is estimated that we will be able to vaccinate approximately 2,000 people during this event. So we're very excited that we have partner agencies that are helping us organize and get residents vaccinated during this event. If you are unable to be on the list and be called for that event, don't worry. There's going to be more events coming into the community. We would still ask for you to register for vaccination with your primary care provider. And the health department will assist with those residents that don't have primary care providers. And then we're also working with those other key agencies in town to get them vaccinated, some of the law enforcement agencies and other federal and state agencies here in the capital city. So now I'll move to Cap Region Medical Center so they can talk about the vaccine efforts that they have going on. Dr. Haight?
Hello, everyone. Capital Region was excited to start vaccinating patients last week. We had initial rollout early in the week with approximately 200, 250 patients being vaccinated. And then Friday and Saturday, we had a large event at Capitol West Event Center, which was great. We were able to vaccinate 1,500 more patients who were in the high-risk category. This week, again, we are planning on having an event tomorrow. at Concord for patients who are scheduled. Again, these are scheduled events. And so we plan to vaccinate 1,000 additional patients. So in the last 2 weeks, we will have vaccinated probably close to 2,700 patients who are at high risk within our community. As Christy says, we're asking everyone to contact their individual physician to be put on a list if you're with one of our organizations. And if you're not, you can establish with one of our organizations or contact the Cole County Health Department and register there as well. And again, we continue to go through lists. People call us, you're put on a list, and as we have vaccine available, we will get people, additional people vaccinated. And I will tell you, our regional group that meets together, it is very collaborative, and we have been moving vaccine around to each other so that we can reach as many people and as fast as we can. Thank you for everyone's patience and understanding as we try to get people vaccinated.
Thank you, Dr. Hayden. Dr. Adams?
Good morning. We are really pleased to be rolling out the vaccine in our outpatient clinics, and we are expanding that pretty rapidly as we've integrated the vaccine into our workflow in those clinics. So we're very pleased, and we just want to remind you that you need to get on a wait list with your primary care provider at SSM, and they will call to schedule you into the vaccine clinic as soon as you fall into the eligible category. Also wanted to point out that if you have fought the fight against a COVID infection and won, you still can benefit from the vaccine. So you should still get on a wait list and plan to be vaccinated in the future. That's all. Thank you.
Thank you. Good points. Ron from JCMG.
Good morning. So JCMG was excited to start our vaccination clinics last week as well. We immunized 750 patients. That was a course of over Thursday, Friday, and then a larger event on Saturday. This week, we've already reached over 1,000 patients for scheduling our clinics today, tomorrow, and Saturday, and we'll be having a large-scale vaccination clinic at JCMG tomorrow afternoon. So we're happy to have started vaccination efforts in Jefferson City for the JCMG patients as well. Want to remind everybody that as you do get your first vaccination, we would encourage you to continue to socially distance yourself. Make sure you're continuing to wear your mask and practice good hand hygiene. We all know that the immunization is not immediately effective, so it's important that everyone continues to follow those 3 guidelines.
Thank you, Ron. Dr. Sullivan.
The Community Health Center is working through our list of patients that qualify for those vaccines, and we are starting to administer vaccines beginning tomorrow. So we have a big event planned for tomorrow. We're also working with some community agencies in developing plans to vaccinate groups of individuals that qualify for the vaccine, but may have some difficulty making it into our clinics. So we have those plans underway as well. We're finishing our 2nd dose of vaccines for staff today. So if you are a patient of the Community Health Center and are interested in the vaccine, call our main number and we'll get you on that list. We are also hosting another round of free COVID testing next Wednesday, February the 3rd, from 9 to 3 at the American Legion. We do recommend you register in advance for that by going to health.mo.gov/community test, and we'll be there from 9 to 3 on Wednesday. Thanks.
Thank you, Dr. Sullivan. So, there's several partner agencies that we're all providing vaccine. I think the main thing for people to realize that, yes, supply is low. We need your patience, and all of these events are by appointment only. So please remember to contact your primary care physician and the organization they're affiliated with to make sure you have an appointment before you come to any of these events. Pre-planning with this vaccine is very important. We have a very limited supply, and once it is ready to be given to people, we have a limited number of hours that we can administer it. And the increments with the vials is very complicated, and we need everyone to make an appointment, and we need you to show up for your appointment. Missed appointments do cause issues, and it is very important that we coordinate those schedules with the patients and with the providers. Sam, do you have an update on the county level?
Yes, I do. And I talked to you about this, but I think Dr. Adams brought this up a week or so ago. You know, I'm active out in the public and I have more people that I talk to, and they're all registering multiple times. They're registering with you, they're registering with their doctor. I had one, they're registered in Eldon, they've registered in just everywhere. So they're registered multiple times just so they make sure they get the shot. And it just really, really disturbs me. And I've got a good friend who finally got his, and I said, I hope you called SSM and the health department, and I forget who else, and canceled your appointments, because, you know, if we've got them down to be vaccinated and they've already been vaccinated, again, we have to scamper to use that shot for somebody else. So I'm just disturbed that so many people I talk to have registered multiple times at various sites. So they really need to just go with their primary physician and be patient.
Very true. Thank you, Sam. Mayor Turgeon.
Thank you. And I would just ask that everybody wear a mask, keep their distance, keep their patience, and take their precautions. And there's so many little things that we can do to really make a big difference together. So I appreciate everybody's coordination on this team and on this call, and in our community working together is how we will get through this together. So please continue to take those precautions, and thank you.
Thank you. And once again, I would like to thank all of our community partners, because I keep explaining to my staff how big a task this is, but it's not our task alone. And we have so many great community partners that are taking the lead in these efforts and vaccinating people very quickly and very efficiently. So we will get through it together. It will take some time, and we appreciate everybody's patience, but it will happen. So at this time, I would open it up for questions. Okay.
I have a question, if you can hear me.
Is that Elizabeth? Can you speak a little bit louder?
Yeah. Hi, Christy. Just wondering if you can explain to viewers how they can, I guess, do they need to register for this event on February 5th, and how can they find more information?
So for the February 5th event, we have been collecting survey information. We've been collecting people's names and information for a few weeks now, and they're already on this list that we have. And so we're going to work from that list of over 6,000 people that we already have at the health department to get people registered. These are individuals that have been waiting a while. So this event is going to go ahead and take care of people that are already on the existing list that are 65 and older. So if they are still needing it to get on a list or get vaccines, they need to go ahead and contact their primary care physician, their doctor, and get on a list that way. But if they've previously registered with the health department, like I said, great volunteers from the Central Bank will be calling them to schedule an appointment. So they really don't need to do anything except be patient unless they're not on a list with their doctor, and then they should call their doctor's office or the health department.
Great, thank you.
Yeah, these events will be happening again around our region with the National Guard. And because our city was selected to be one of the first, we thought this was the easiest way to get 2,000 people scheduled in such a short amount of time. We already had this list, so we wanted to go ahead and do it as quickly as possible. But there will be other events coming up.
You may or may not have on this press briefing, but the COVID website, the covidvaccine.mo.gov website, and how the tiers and everything are listed on there as well, because you are going through that, following the state's guidelines for the tiers.
That's true. So people can either look up Mo Stops COVID or covidvaccine.mo.gov. and that is the website that the DHSS has all the information about the tiers. They've also added, thank you for bringing it up, Mayor Trojan, a new dashboard that shows the number of vaccines that have been administered in the state per county. So they're adding more information to that website all the time. It has the consent forms out there, it has the tiers, it has information about the vaccine, and now it also has information about how many vaccines have been administered in the state of Missouri per county. I did just receive a question. Yes, the event on February 5th and 26th for the second dose will be held at the link. And we're so very thankful for Jefferson City Parks and Rec for allowing the use of that facility.
And to reiterate, people should not show up at the link unless they are pre-registered.
It is by appointment only. Thank you. All these events are by appointment only because of the complicated scheduling, so we appreciate everyone's patience. At some point in the future, when the vaccine supply is more robust, we might be able to host a mass vaccination event, but pre-planning and pre-registering is key right now.
I think one of the things we'd like to offer up from JCMG and Dr. Haymaker as well, just hosting a similar large type event, would be asking for patients not to arrive actually too early prior to their scheduled appointment. We give you appointment slots for specific times, and arriving early, sometimes can just make that more congested and add to your additional wait time. And so we would just ask that when you get registered for that appointment to be no earlier than 15 minutes early than your scheduled time. That would greatly help the flow of the clinics.
That's true. For the event at the link, we're going to be scheduling 72 people every 15 minutes. So in order for it to work like clockwork, we need people there at their scheduled time, not too early. Please be on time, and please make sure you have an appointment, and don't bring anybody else with you. If you have an appointment for you, then you need to come, and we will not be able to accommodate other guests that you bring with you that want to get vaccinated. The appointment is just for you. All right. Any other questions or comments? Okay, well, again, thank you everyone for being on the call today and being such great community partners. We appreciate you, and I hope you have a great day. Thank you.